HIV testing service remains a critical element in the provision of HIV-related care and prevention. In its effort to scale up its HIV response, Kenya is set to transition to the new World Health Organization's recommended HIV testing strategy that leverages the use of 3 consecutive reactive tests for a HIV-positive diagnosis. It replaces the 2-step strategy the government seeks to phase out, in line with WHO's recommendation for countries with a prevalence of 5% and below.
The recent evidence shows that using that 2-test-based algorithm has a limitation at population level, where there could be some cases that are not correctly classified for appropriate intervention.
The strategy comes on the backdrop of accelerated effort to meet the global 95-95-95 goals that seek to make testing accurate, affordable, and high impact.
The new 3-test algorithm therefore increases our opportunity of correctly classifying somebody at the point of service within a shorter time with accurate results and linking them to the correct treatment.
According to experts, the algorithm involves the use of a combination of tests which are performed sequentially. The first test is known as a twin screen, which is used for screening for all populations above 18 months. The second test, known as standard Q, is used to screen all pregnant women who present for the initial test at the antenatal clinic in any trimester. This can also be conducted during labor or delivery. It is also used to test partners accompanying pregnant women for the first time during ANC or postnatal period. The other tests, known as one-step and fast response, are confirmatory tests when the standard Q test is reactive and when both the twin screen and standard Q tests are reactive respectively.
This client was positive with our first test, which is twin screen. So we subjected that client to our second test, which is one step. And as you can see, there are 2 lines, which means control line is, as indicated, the same to our test line. So therefore, this client has been confirmed with our second test as positive. Any line, even if it is faint, that is a positive client.
The government now hopes to get the ball rolling by July 2024, when it plans to phase out the current testing strategy in phases. The regions selected for phase 1 rollout include Wajir, Garissa, Mandera, Marsabit, Isiolo, Lamu, and Tana River. In the second phase, counties like West Pokot, Embu, Laikipia, Kiambu, Bungoma, Meru, Murang'a, Bomet, and Kirinyaga will adopt the new testing strategy. Thereafter, Kilifi, Makueni, Nandi, Narok, Kwale, Nyeri, Machakos, Turkana, and Kericho will follow suit in adopting the new test strategy during the 3rd phase of the rollout program. They will be followed by Taita Taveta, Kitui, Nakuru, Trans Nzoia, Nairobi, Kajiado, Kakamega, and Uasin Gishu in the 4th phase, before the remaining counties of Vihiga, Samburu, Kisii, Mombasa, Busia, Migori, Siaya, Kisumu, and Homa Bay complete the process.
PEPFAR supports 40 counties, but not the ASAL counties. But the Global Fund grant that ends 30th June supports the ASAL counties. So in order to optimize and support the ASAL counties, we prioritize them as the beginning.
In a bid to expand HIV response, experts advise the need to enhance HIV prevention as well as treatment to curtail the transmission of the virus.
When you are infected with HIV, you are infected for life, and you are going to be on treatment for life. When we find an effective and affordable HIV vaccine, you may only need 1 or 2 doses and you are totally immune. Exposure will mean you don't get what? Infected. So a vaccine will actually be a very cost-effective tool in management of HIV and AIDS.
They also say that ongoing research to come up with better medication with less side effects and reduced pill burden will go a long way in ensuring drug adherence and treatment continuity. Gloria Milimu, KTN News.